There's no need of going to a childbirth class and learning techniques and learning how to cope in labor, because maybe they'll go through CS. Is there a justification?
You see, cesarean section is an, what would I say? It's a morbidity. I have an appendectomy scar here. Already that is a morbidity to me. Now, when you have of course, let us have a cesarean section because somebody has seen I'm endangering myself, I'm endangering my baby's life, but not as a way of delivery. I will say it very plain here. Women are scared of going through labor because they think, oh, the oncoming baby, or then after 6 weeks I will not enjoy sex. Remember, any muscle that has been stretched, taking it back to its pre-pregnancy state is much easier than a muscle that has not been stretched. Okay? So a birth canal which has accommodated this big baby's head will actually, through Kegels and any other exercise, be able to go back much, much nicer. Because when we get pregnant, believe you me, we all expand. Our birth canals expand because God has made it such a way that baby should be born normally. And so we all expand, we all are lubricated, ready for the baby to come out. So me, I have decided I'm going for cesarean section. I will do more vigorous exercises for me to go back to my pre-pregnant state, unlike Mercy, who has gone through normal delivery.
Just to add on what Sister Nerea said, it's very, very important that at least you attend these childbirth classes. They are very important. You have to learn all the other techniques of how you're going to handle labor, how you're going to be through the whole process of labor, and you also have your expectations and also the outcomes. What do you expect and what will be the outcome of the whole process? Simply because all these things that you're being taught will be helpful to you through the whole process. And I'm saying this because sometimes we would experience mothers, especially the first time mothers, who don't go through these classes, and once they come for the delivery, you find it's very, very difficult actually even to handle them. It's not their fault, but we'll always encourage them, please just attend. Because some they'll tell you they know the breathing techniques, and once it comes to the delivery itself, you ask them, now can we do now? You do your breathing exercise. It's done differently, and maybe sometimes even the expectation of how you feel when the baby is coming, they always close up their leg because they don't know to differentiate when the baby is coming or when they are going. You see, and by the time you're like, oh, the baby is here, I'm sorry to say there's some accident that happened some long time, not in our facility, but actually where we had gone out for outreach, that the mother who came to deliver didn't know that the baby is coming, and by the time we knew the baby was coming, the baby was almost even falling because they had to push the baby, just got out like whoosh. It was only the cord that really held the baby. The baby was almost down. So to avoid all these accidents that are happening, it's actually good to get this information. Please pass it to other mothers that it's important when they go for the clinics. It's only not going to be felt their stomach and the heartbeat, just to be reassured that the heartbeat is there. Ask for information. What do I really need to know? What do I really have to prepare? How do I prepare myself? Because you have to prepare yourself psychologically and physically, so that for the whole process to be good for you. Yeah, I think that's
Childbirth education will actually take you through all what you've said, from pregnancy to labor to delivery to taking care of yourself to actually then breastfeeding. We also do a lot of extensive breastfeeding so that we are not called to go a firefight because the mother has been discharged and 12 hours later the baby is not breastfed. And let me put it this way. There are a number of women I've seen in my center who have come because the first way pregnancy, they were not prepared and they didn't know what to expect. And a lot of them, I don't know that they were taken advantage of. I can't say that because I wasn't there. But they have gone through cesarean section with the first pregnancy. And of course, somebody is telling them, once you've had a first baby pregnancy, cesarean section, you can't deliver normally. And I have had a number. Of course, I'm not saying it is me. I've taken a few through this childbirth education, and then finally, said, okay, we are going to try labor. And I can tell you, we have had a lot of successes, because now these women, in as much as they have a cesarean section scar, but they don't have whatever made them go through cesarean section, whatever those conditions, they don't have them now in this current pregnancy. And of course, it wasn't because the baby was too big, because if the baby was too big, then we take precautions. And remember, I'm a midwife. So after doing proper assessment, we are very sure this girl can go through labor. And of course, we go to a hospital where we can have intervention. And we have realized delivering after cesarean section is very possible. I have quite a number, and they're very excited because they have gone through labor and they've delivered, and they're thinking, wow, from their experience where they had a cesarean section, it is not as, now it is easy. One of them actually said, imagine I can actually jump out of bed if I had gone through cesarean section, because that's something you can't do, because the sky is raw and the pain is real. Of course, we give a lot of painkillers, but they are excited. They are, of course, now already exited into breastfeeding, and they are telling me that joy is real, that they have gone through this successfully.